And well, I got it. Good. So it's a real pleasure, as I said, to open this webinar. And I do this also on behalf of Jody Oakman, the chair of the scientific committee of ICOH, Aging and Work, but also on behalf of Hans-Martin Hasselhorn, who initially proposed this joint webinar between the ICOH Scientific Committee, Aging and Work, and the Omega Net Cost Action. And for those who don't know the Omega Net, well, first of all, we have 3 speakers and 3 presentations from the Omega Net, and I will say something more about it within a minute. But Omega Net is a European Union funded network of occupational health researchers who coordinate and integrate occupational health cohorts. So on an international level. So maybe some of you or all of you are already involved in this network. And one specific task of this network is to harmonize conceptions relevant to occupational health. And one subgroup, the participants investigate different elements of the work retirement transition in cohort studies to get a further understanding of the crucial conceptualizations and the indicators for this transition from work to retirement. So, but more information about this network you can find on their website. And well, this joint webinar is related to these concepts of the work transition, retirement transition, and the concepts are health, retirement, and healthy working life expectancy. And I think we have a very nice program for the next 1.5 hours, or I already need to say that we will try to end this webinar at 12:15 Central European Time, which gives us a bit more time to have a break before going to other meetings or to do something in the evening when you are elsewhere in the world. Well, we have 3 speakers who are all 3 experts in this field, namely Taina Leinonen, Svetlana Zoloviva, and I hope to pronounce it well. They are both from the Finnish Institute of Occupational Health, and Hans-Martin Hasselhorn is one of the 3 speakers, and he is from the University of Wuppertal. And as I said just before, I would like to mention that all 3 presentations originate from the work in the Omega Net task group, Healthy Aging and Work Participation. So the 3 speakers will give a short presentation about the 3 core concepts of relevance, which I just mentioned, in retirement research. And about the format of this webinar is that, of course, questions for clarification can be asked immediately after the presentations, but we would also like to have this plenary discussion at the end. So if you have questions for one or more of the speakers that go further than the presentation, but address the concepts of work transition, retirement research, please save those questions for the end. I think so for this brief introduction. The first speaker is Taina Leinonen, and she is a chief researcher and adjunct professor in public health at the Finnish Institute of Occupational Health. And her research focuses on socio-demographic differences, trends, and the effectiveness of social security related interventions promoting work participation, such as the use of partial work disability benefits and vocational rehabilitation and training. And she is involved in several related projects and participates in the Omega Net. And her presentation will be about a conceptual framework which she will present. And that framework addresses the complex labor market dynamics of the work to retirement process. So please, Taina, the floor is yours. And you will share the sheets yourself, I guess.
Yes, thank you very much, Karin, for the introduction. I will now try sharing my presentation. Can you see this? Good. So I'm Taina Leinonen, and I will now introduce this conceptual framework that we developed in the OmegaNet project together with my co-authors. And we try to address the very complex labor market dynamics that are related to the transition from work to retirement and this process. This is based on an article that has already been published. So you can find it in the European Journal of Aging. So starting with some background to our work on this conceptualization. Previous studies have widely used different conceptualizations and measurements of retirement, and how retirement is defined is likely to influence the research findings. This is why some conceptual clarity is needed in this research area. The transition from work to retirement is very complex. More or less, retirement can be related to the withdrawal of older workers from paid employment, but it can, the nature of retirement can be very diverse. It can happen in many different phases, and sometimes it can even go in the reverse direction. There are various elements relating to the transition from work to retirement. These include, for example, bridge jobs, part-time work, early, late, and partial retirement, the work disability and unemployment paths to retirement, and working pensioners. So the individual can be in many different kinds of labor market statuses while being in the process towards retirement. So retirement can often, or it has often been seen as a process instead of a single event. And even though previous literature has widely conceptualized retirement and its elements, there is still a framework that would comprehensively address the connection between the different labor market elements that relate to this work to retirement process has been previously lacking. So in our work, we aim to build on this previous literature to develop a conceptual framework of the work to retirement process that would help guide future measurement of retirement. So before introducing our conceptual framework, I give some examples of previous conceptualizations and measurements of retirement. And it should be noted that when reading the literature, it's not always clear cut what is considered as conceptualization and what is measurement, and they are very much linked together. And ideally, you would first conceptualize retirement and then see what's the best way to measure it. But in practice, this is often restricted by availability of data, for example. So you have some information on retirement based on which you measure this, and then conceptualization is more based on that. Now in 2009, Denton and Spencer published an article where they reviewed how retirement has been addressed in previous studies, and they identified 8 different categories. Retirement, the definition of retirement related to non-participation in the labor force, some definitions related to the hours worked or on earnings, also on the receipt of retirement income, and some definitions related to leaving the main employer or changing employment or career. Then there was also self-assessed retirement or some combination of the categories above. And even though they found that retirement was in fact defined in several different ways, all of these definitions are still like dichotomous, that based on these, either you're retired or you're not retired. So it was still defined like as a single status. Retirement has also been conceptualized as more as a process. For example, Cahill et al. Has introduced a model with various paths to retirement. They see retirement as a continuum between full-time career employment occurring here in period 1 and complete labor force withdrawal in period 6. And in between, there may be reduction in work hours, which is the horizontal axis, the vertical axis, sorry. And in between there may be various paths, retirement paths, including phased retirement, continuing in the career job but reducing hours. Then there's a new bridge job in a completely new job, and then there may be re-entry after initial exit from work. Also, empirically, retirement has been seen as a very complex and diverse process. Here is a study by Calvo et al. Using data from the United States. And here they identified different retirement sequences based on 7 different labor market statuses, which are indicated at the bottom. And these were working full-time, working part-time, partly retired, retired, unemployed, disabled, and not in the labor force. And based on these different labor market statuses and their changes by age, they then empirically identified these different retirement sequence types. And you can see that they were very, very diverse. So it's not always a simple single event. Okay, then I move to introducing our conceptual framework. And even though there are various conceptualizations and rich conceptualizations of retirement in the previous research and conceptualizations related to the different elements of the work to retirement process, there's still was lacking a framework that would conceptually connect all of these different elements relating to the complex process. So we try to bring some conceptual clarity to this issue. And here I present our conceptual framework of the work to retirement process. And the arrow at the bottom presents time over this work to retirement process. And in this framework, there are three main elements. It's being employed, a pension receiver, or in other status, and these are represented by the ovals. And you can see that the employment and pension receipt, they are overlapping, so a person can at the same time receive a pension but continue working. And then at the middle, the vertical line represents the statutory retirement age. And these main elements and the statutory retirement age divides these into 8 different areas, which are numbered. And looking at number 1, that would be what would typically be considered as kind of normal employment. So being employed before reaching the statutory retirement age and not receiving a pension. Then looking at, for example, the category 6, would what most people would think would be like fully retired, not being in employment and being beyond the statutory retirement age and receiving a pension. But then there are various statuses in between where you cannot always say whether a person is retired or not retired. It's something in between, and we don't want to try to define what is retirement. We rather try to show the conceptually show the connections between these different elements, and in this we see this as a process. So for example, before the statutory retirement age, a person can take early pension, which are the areas 3 and 5, and a person can also continue working after the statutory retirement age, which are the areas 2 and 4. Now, this is the simplest version of the framework, but then there are various specifications that can be added. And here I present model examples of these specifications. There can also be other ones, but we wanted to show these as an example. For example, employment can be with regular work duties, or it can be with reduced work duties, meaning, for example, fewer work hours or reduced work demands, or both. There may also be breaks from employment, for example, due to sickness absence. Then both early and statutory pension may be full, or it can be partial. And early pension can be due to disability or other early pensions. And this status other, meaning not being employed and not receiving a pension, a person can be unemployed or completely outside the labor force for some other reason than pension receipt. So with this framework, our aim was to guide future measurement. And how this can be done. Well, it's not always feasible to take all of the complexity that I just showed into account in a single study. Like how this is addressed in measurement, it depends on the research context and research questions and the available data and methods used. But we believe that this framework helps to elaborate what is actually addressed when we investigate retirement, because retirement can mean so very many different things. So the framework can be used to enhance well-defined, precise, and also comparable measurement of this work to retirement process. For example, it can help in developing and harmonizing measures, retirement-related measures, or it can help in interpreting the results or comparing results between studies. Thank you very much. This was my short presentation.
Well, thank you very much, Taina. A short but very clear presentation, and to share your ideas about the formal definitions of retirement and a framework that emphasizes that retirement is not a single event but a process. And I saw in the chat that there was a question from Damin Elveni, and he wonders, in the novel framework, what if a person's main pension provision is in a private or company pension, which may be taken at a different time to statutory retirement? Damin, if you want to add on it, please.
I have a little bit trouble hearing. I don't know if others also.
Okay.
Yeah.
But I think I at least partly heard the question. So was it that does this take into account whether it's like private? What was the question?
Damin, do you want to ask the question to Taina?
Hi, Taina. It's Damien. How are you?
Fine, thanks. How are you?
I'm good, thanks. Yeah, it was just in your framework, how did you, because some people may not be dependent on the state retirement age pension and may have a company or a private pension. So how do you account for that in your framework? Do you just add an extra level of complexity with the different pensions?
Yeah, that's a good question, and that can definitely be added as a further specification in the model. So it can, if there is no option for statutory pension, for example, a person can also, beyond the statutory pension age, receive a pension that is, for example, based on company pension. So this is kind of flexible to the user, so there can be additional levels that can be added. But in most countries, there is still this statutory retirement age that somehow also gives some sort of notion of the norm when is the right time to retire.
Okay, thank you. I just understood from others that I am not being heard very easily, that it's interrupted. I will try to figure it, and but are there any more questions? Okay.
Oh, yeah, I had a question. Can you hear me?
Yes.
It's Mary Beth McLean from Canada. I know that there's different ways of defining retirement timing, and I guess I kind of already heard a little bit about why you chose statutory retirement age. I gather it's because most countries have a statutory retirement age, but would you be able to, or you think you could use this model and conceptualize timing differently, like you know, the expectations of you know, when you would retire, or the time you would have desired to have retired?
When we started working on this, we saw that there are already previous conceptualizations looking at retirement process from like a psychological perspective. So we focus this only on like more objective labor market participation based statuses. So we deliberately did not address these issues such as retirement expectations or perceptions of what's the right time for the individual to retire, for example. So this is more of a labor market participation perspective.
Yes, yeah.
But we do address this issue in the paper.
Right, great, thank you.
Thank you.
Okay, thank you. Is there anyone else who wants to ask a question for clarification or just a brief question for Taina? If not, we continue with the next speaker, and I hope that, that my voice will be a bit better right now. And the next speaker is Svetlana Soloveva, and she's also a chief researcher at the Finnish Institute of Occupational Health and adjunct professor in epidemiology at the Helsinki University. And her research focuses on the prevention of work disability, but also on enhancing work participation and prolonging working life and combined exposures in the work environment. And in this webinar, as you will see on the slide, she will give a presentation about the conceptualization of healthy working life expectancy, including some examples illustrating the different concepts of working life expectancy and healthy working life expectancy, and different approaches to estimate these indicators. So Svetlana, if you are ready to present.
Yes, I'm ready. Yeah. Thank you, Karin, for the presentation. And first of all, I would like to acknowledge collaborators with whom we start to work within the Omega network, and we are still continuing because so far we have not yet published results of our work, but it will coming in the nearest future. And as Karin already mentioned, that beyond the discussing the concept and operationalization of healthy working life expectancy, I would also talk about working life expectancy in general, because these are very related terms and would be needed also to better understand the concept of healthy working life expectancy. Despite an increased life expectancy and a better health status of the elderly employees, the average time people spend in labor force is relatively shorter than life expectancy. And on this slide, I just an example to show scatter plots, which is showing correspondence between life expectancy and time expected to be spent at labor force at age of 15 for selected European countries, and this is for both men and women. And in the upper left corner, I appear in countries where the gap between life expectancy and working or time spent in the expected to be spent in the labor force is larger. And you can see that there are more countries where this gap is large, for example, among female, and this is just for illustrate this different problem that exists. And working life expectancy as a measure of duration of working career was first introduced in 1977. And at that time, it was defined as a measure for the future time that the person at a given age is expected to be economically active during the remaining lifespan. At the moment, there are different terms in use, And there are no standardized terminology. And already also what Steiner mentioned during her presentation regarding the retirement conceptualization and the transition, also different understanding or interpretation of this concept leads to the complexity of comparison of these estimates. And because they are different, they are to some extent cover different phenomena. For example, if we're speaking about labor force expectancy or labor market expectancy of active life expectancy, then it's typically meant the time that expected to be spent in both employment and unemployment. So now we would try to get a little bit insight what is the working life, and then what can be what the meaning of being at work or economically active means in this concept. If we would see in a general that the working lifespan is something within the lifespan, and in the general it might be limited by the time that the person is entering the working life and the exit the working life. And as also that during the previous presentation, so and the question that have been raised, this withdrawal from the labor market might mean that it's at the time when there is time for statutory retirement in the countries where this exists, or it also might mean that there could be people can stay in the labor force after, beyond the retirement. And the working life is not as a continuum, and so these cannot be just be the difference between these two time points, or this difference between the time when the person is exit from the labor or working life and or entering would give very rough estimates of working life duration. During the in reality, during the working life, there are several, could be several interruptions for temporary interruptions, and these need to be taken into account when the calculating working life expectancy, and also the interest in taking a complicity and not continuum working lifespan into account when doing the estimates also brings to the researchers to be aware of different ways conceptualized working life expectancy. Due to this, that if we would limit the estimates of working life expectancy not or to the time that it's withdrawal from the labor market, then the new revised definition of working life expectancy appeared, and it is denotes the time that a person at a given age is expected to participate in the working life until permanent withdrawal. It is important to keep in mind that working life expectancy is not the same as retirement age or average age of withdrawal from the market, because this is a prognosis of the time that is expected to be spent and not an actual measure. And the same, or the most close concept that is also used in research is expected retirement age. But then in a general, working life expectancy is qualitatively more superior measure than average of working life duration, since it takes into consideration the complex interplay between changing during the life expectancy and transitions between different states of work participation. To sum up, in the literature that can be found, there are three mostly common concepts of or definition of working life expectancy, with the different detailization or specifications of the being at work or working. The most general definition, it is takes the estimation of the years expected to be spent in the labor market, meaning that it both employed and unemployed. More narrow definition would be only of estimation the years expected to be spent in employment, and even further narrow definition that it would be estimating the years expected to be spent in productive work, which would mean that it's actually be working and not be absent due to healthy or non-health related reasons. And now we will move to the concept of healthy working life expectancy. But before that, I would also just on this slide to show the relative relationship between the concept of life expectancy, healthy life expectancy, and working life expectancy, because all of these concepts are used in terms to develop the concept of healthy working life expectancy. And these are the results from the recent study and showing the for selected European countries, the partial life expectancy between ages 50 and 59 for women and men in 2017. And by the black dot on the slides, it indicates the working life expectancy. By the transparent circle, it's the healthy life expectancy, and by the asterisk, it's life expectancy. And as you see on these plots, that in for most of the European country in both genders, the working life expectancy is higher than healthy life expectancy, which means that the necessity to differentiate between healthy and unhealthy working life expectancy. So in 2007, the concept of healthy working life expectancy was first introduced, and it's incorporate both the healthy health and working, being at work, and thus it's defined as indicator for the future time that a person at given age is in expected to be healthy and be at work. And conceptually, it is, as I already said, it's similar to healthy life expectancy, with the difference being that the former occur in the context of labor force participation rather than in health statistics of the general population. And what is the meaning of being healthy in this concept? So if we would take on the left side of the slide that how the healthy life expectancy is interpreted and what are the conceptually concepts are used in the literature. So it may be years persons expected to live in full health or being active without disability, and or might be in good self-rated health. Then if we would move that how this would help us to conceptualize the healthy working life expectancy. So being healthy in this case could mean that it's also good self-rated health, that it's no disability, it could be good workability, it could also be non-absence from work due to ill health, and also which might be the more difficult to assess as a no sickness presenteeism, so that if to limit to this to really productive working life. What is common to both of these concepts, and I already mentioned this, that these both working life expectancy and healthy working life expectancy are not measured directly, but they can be estimated. And for estimation of these indicators, multi-state methods are used. And these are the adaptation of the estimates earlier been applied for healthy life expectancy. And the general approach includes that the total life expectancy is divided into different states in terms of labor participation, health or functional ability, and the average expected time in those stages is estimated. As a major labor market states typically used in the literature, it's employed, unemployed, or economically inactive. I would not go to details of the methods for the estimation and just give a brief overview of two major approaches that I used. It's either prevalence-based methods or incident-based methods. And prevalence-based methods is known also, one of the examples is the Sullivan methods. It require cross-sectional data on mortality and also on the prevalence or rates for the states of interest. And this type of data could come from survey, or it may also come from the official statistics. It's relatively easy to use in the calculation, but it also has some limitations due to more precise estimation. The estimates need to be provided for some subpopulations, and this may cause difficulties in availability of such data. Another approach is incidence-based, and it's based on the cohort or panel data. And in general, it estimates the transition probability between different states that are selected to be looked at, and reflect the time that person could spend in these states or move between them across the time. And these transitions might be daily, weekly, monthly, or annual. And also the source of the data is not necessarily only the register data, but it also can be survey data with some time points, or, as I mentioned, also unrelated cohorts as a panel data on the similar representative population that can be used for the estimation of input data for these calculations. And now I would show some examples where this concept of healthy working life expectancy has been used. Just briefly show what are the meaning of being healthy in those studies and states of the interest. This is the study where this concept was first introduced, showing the healthy working life expectancy for the people between age 50 and 60 and 60 and 70. And it combines both data on health and employment status taken from the survey data. The source of the data is European Community Household Panel. There are annual transitions taken from those studies, and the follow-up is consist of 7 years. Being healthy is in that study was as absence of any chronic or physical or mental health problems, illness or disability, and working was defined as being employed in a job or being self-employed involving at least 15 hours per week. The methods used for the calculation was incidence-based with the annual transitions between the 4 states of interest that have been selected. And on the right side of the slide, these are the 4 states that have been specified, and the transition between these states were used to make the estimates. And one assumption what is made in this study that because they did not take to the account the absorbing state deaths, and they assume that all people will survive to the age of 70. So in those 4 states of the interest, if we take the first right and the down right states, so they would correspond to the healthy life expectancy, and we would, if we take 2 states in the first row, this would correspond to working life expectancy, and the healthy working life expectancy, it would be upper left box. Another study, it's also published very recent, so it's in 2021, and in this study, the being at work meant is actually being working and be present at work and not receiving any health-related benefits. And this is in that study, so there were much more states of interest included. So there was the this aggregation of the states that would be corresponding to non-work participation. And so they're much more complex model, and there are much more transitions of the interest, but this was of the interest particular research. And in that study also the incidence-based methods were used, and the estimates were based on the daily transition between 7 states of interest. And to sum up and make some short conclusion based on the this presentation, so it is still in infancy, the definition of being healthy when we are speaking about a healthy working life expectancy, and therefore further elaboration is needed in the concept of health in this healthy working life expectancy. It is important to keep in mind that the conceptualization of both working life expectancy and healthy working life expectancy depends on the field of research and the future use of these indicators, but it's very important to take this conceptualization and differences in it when the results of the studies or these measures are compared, particularly across the countries or across the different studies and also across the time, because the value may very much vary. And operationalization of these 2 concepts, including selection of the labor market states and statistical methods of the estimation, would depends mainly on the availability of the data, but also on the research questions and applicability and further use of this indicator. So, and this is all. Thank you for your attention.
Thank you very much, Svetlana, for this very nice and nice presentation, where you conclude with there's still much to do on the concept of working life expectancy, and especially healthy working life expectancy. Although we are already running in time, I would like to ask some of you who wants to ask a question to Svetlana, and to see from Sang Choi, would you please ask the question yourself?
Okay, thank you very much. Can you hear me?
Yes, very good.
Okay, great. So very wonderful study. Just wondering, especially WLE or HWLE, I'm wondering, there are different industrial sectors might have influence to these concept in there, such as construction industry, such as healthcare. I know there are certain high hazard industry retirement age is not by the statutory, but by the work hazards. Some work hazards because of they have retired earlier. So have you considered any of those elements in your model? Thank you.
Yes, actually, in the model, so you can define what is the age period at which you would like to make the calculation. So you can have this, as it have been done earlier, not make any sensory to age, and then to do the estimates to until or center by death or very up age limits, and then this difference in the timing of retirement for different industries would be taken into account. And also, if you would set up that as a endpoint for the estimation is statutory retirement age, it's still the estimates will provide the working life expectancy at each given age, and then for those industries, so then they just the estimates would or you would see how the estimates of working life expectancy would be very much reduced after the certain age where this retirement in the industry is actually take place. So this is not a very big issue in the modeling for the calculations. So it has some flexibility because beyond the estimation of working life expectancy, it's also you also estimate the time that the person is expected to be spending outside of the working life, and this is then in such industries where they drop out of the working life earlier. So this the time outside of the working life would be then larger. So I don't know if I answered your question. So if
yes, you did. Thank you very much.
Yeah,
Okay.
thank you.
Thank you. And there's another question, which is really interesting. It's from Deborah Klaas as to the consideration of the type of work. Deborah, do you want to explain or add something more of your question?
Not really. Just to you know, reflecting as I get older and stiffer, I can still carry on doing my work more or less, but I couldn't if I was a bricklayer. So how do you take into account the industry that people are working in?
These calculations are produced for the either the average like entire population. It also can be produced for the subgroups, but then it means that the input data for the calculation, so in terms of the proportion of time or the rates or the prevalence of specific states, they need to be available for those subgroups. And then it would be possible to make estimation not only in the general terms, but also by the different subgroups. For example, there are several studies where the estimates showing the difference in the estimates by the social demographic or social economic factors, by education, occupational class. There is also few available on the specific occupational differences in working life expectancy, and as well as we publish in Finland. Unfortunately, it's only in Finnish, but it's available on the time trend in the working life expectancy by the industry. So it is possible to make calculation also on these groups of different, if the data allows.
Good. She already is fine with your answer, with your response. So thank you very much. And the last question that I would, for which I would take the opportunity is whether there are general indicators that can be used to determine the stage at which to implement programs to enhance workability. Muchiri, if I pronounce it well, is that correct? Do you want to add?
I think there are different softwares that could allow these estimates, but then there are two general approaches that need to be first be considered. So depending, as I said, on the data that are available and also of the interest. For example, in the labor market research in the general, that if we do not take the health aspects, and we are not really interested whether the person is actually working or employed, then the more general definition of used, and then it is time expected to be employed or unemployed, considering that unemployment is the people who is actively searching for the employment. And depending on this, what you actually would like to estimate. So, or make a projection, but it can be, because this is in a way prognosis, so it is quite a useful indicator in the for the policymakers to see what it could be expected on the time what is happening now, and then also would in a way indicate the potential on what you should influence and to see if you would like to have make a difference in the future. So what you would, and this also would depend whether you are interested in really in employment, and then increase, whether you can see increase in employment would make an effect or by the prognosis and how much it would weigh. And then in the time when the time passed, you can also see whether the prognosis is changed towards what is actually happening. And there are also many factors that may affect the process and then prognosis and the changes may occur. But this was a little bit outside, and then would not allow to make that short presentation if to speak about the other factors that may influence on these estimates and affect the prognostic possibilities.
Yes, thank you very much. And then we continue with the final presentation by Hans Martin Hasselhorn, and he is a professor of occupational health at the University of Wuppertal, and for a long time, I think more than 20 years, his research is dedicated to older workers, and more specifically the transition from work to retirement. And he informed me that this topic is also the focus of the German National Cohort Study on Work, Age, Health and Work Participation, LIDA, which is an abbreviation of the German language, of the German words, and which is managed by the Department of Occupational Health Science. Well, Hans Martin will, in his presentation, explain about, it's already shown on the slide, the role of health in the transition from work to retirement. Well, Hans Martin, please, it's up to you.
Sorry.
Okay.
Now I have to do it again.
And I think you were still on muted.
Yeah, but now it's okay, isn't it?
Yes, we hear you.
Okay. And now you can see it again,
Yes.
I assume, isn't it? Perfect. Okay. So yes, thank you very much, Karin, for the introduction, and also thank you, Taina and Svetlana, for this joint meeting on this issue of the work retirement transition, which indeed is what we are doing in Wuppertal. And what I'm presenting today is also, like Taina, it is a manuscript, or it's an article actually that has been recently published, and you can download it for free from the Scandinavian Journal of Work Environment and Health. And I think the main word in the titles are the differentiated roles of health. Yeah. Health may have different roles in the transition from work to retirement, conceptual and methodological challenges and avenues for future research. That's what you find in the article. And the author group of this actually very stimulating, wonderful work was, besides myself and Jean-Baptiste from Germany, from a department, also Taina and Svetlana, who we have just heard from Finland, Ute Bildmann and Astrid de Wind from the Netherlands, Ingrid from Oslo, and Sibyl Kiran from Turkey, and Nicole Marjorie from Luxembourg. So it was a great international collaboration, joint thinking and writing, as you know. And this all happened within the task group 3.1, as Karin has said. As we all know, a common notion is that the crucial factor for the future economic and social development of our societies will be the health of the future older working populations, and also the national and also European policies are emphasizing the relevance of preventive health programs for prolonging working years. And also retirement research has very much focused on the issue of health as a core determinant on staying in the job or leaving early. And usually the understanding is as follows. It's straightforward. Poor health leads to early exit from work. But what we believe, the authors of this article, is that this understanding may fall short in reflecting the diversity of the many different roles that health may play in the transition from work to retirement. And I want to illustrate the problem with German figures. Now, in 2014, there were 17 million people aged 50 to 64 in Germany. Of those, 12 million were working and 5 million were not working. And among those working, 1/3 reported poor health. And among those not working, half of them reported a good health. Yeah? So this means this means that not all with poor health, or not all, that among those working, not all with poor health have left working early. And among those no longer working or not working, there must have been other reasons than poor health of driving these people out of work. Yeah? The conclusion is that there must be further mechanisms effective in the health retirement relation. And when it comes to prolonging working life, which is the political guidelines in our times, it of course is highly relevant to be able to understand this. And this is a question not only relevant for national policy, it could also be an issue of relevance for organizations. So the aim of the discussion paper were these 3 different points. And the first 2 points are to identify the differentiated roles of health in the work retirement transitions, and then to develop conceptual and methodological problems and challenges. And then I'm presenting avenues for future research. For the first 2 points, I only show you 1 slide. And this is the slide, and this is what we've just been talking about. Let's call it path 1. Poor health is leading to early retirement. But then we are adding further paths. What we also find in the literature that also good health could lead to early retirement. And here we very much rely on qualitative data. And there is one Australian called Rachel Pond, who has developed 4 different pathways of how health is affecting the exit from work. And 2 of these pathways fit to this path number 2. And the one is the protective pathway. Now let's say there is a person 55. This person has good health, but this person wants to retire early because this person says, I do have good health today, but I'm afraid that my hard work will make me sick in the coming 10 years, and I don't want to risk that. And the other fear that this person might have, that it's not the work per se, but that the person, when working, would not have enough time or resources to take care of his or her own health. So this was the protective pathway. And another pathway where good health makes people retire early is one which is probably quite common. That's the maximization of life pathway. And that is when people decide to retire while still healthy so that they can fulfill personal goals. In Germany, many people are out in Europe probably are driving around, young pensioners are driving around with their mobile homes, for example, or the older people want to climb on the trees with their grandchildren, for example. Now, the third path is that poor health may also be associated with retiring later. And the question is, when do people with poor health retire later? There are 3 answers to that: when they can, when they want, and when they have to. Yeah? And if it comes to I can work, in a Dutch study, half of those with unspecific chronic musculoskeletal pain reported no health limitations. Yeah? And as an example. And when it comes to want to work, there's the study by De Vries, who found that among those people with poor health who wanted to work longer, that they considered work to have a value. Work was a therapy for them, and work gave them the opportunity to bear responsibility. And then when it comes to I have to work, this is, there are many people, and we have actually analyzed data in our leader study, and we have found that those with the lowest quintile of income, that this group was the one that wanted to work longest. And this group, of course, had poorest health in relation to all others. But what was most interesting is that only in this group, the health was no longer related to the timing of retirement, of preferred retirement age, which means that these people, they are trapped in their unemployment, and they have no choice to go out because they do need the money. Then finally, this path, good health to retiring later. Again, now we are relying to qualitative work, and there are British and also German studies investigating this issue, and the participants in this situation considered their good health as a precondition for working longer, often in combination with a high job satisfaction. Okay, so as we see, there are many different paths, and of course we are a bit afraid that this poor health retiring early path is so dominant that we are overseeing the other paths which are of relevance for our workforce, as you know. So now the avenues for future research. And just have to move something here. Okay. So the first one is what I've just been talking about. The strong overall association of poor health with early exit from work bears the risk of masking distinct and deviating mechanisms in subgroups. For example, among those with low financial resources. Quantitative social epidemiology should attempt to identify the mechanisms suggested in qualitative research and take them into consideration when interpreting the findings. The second aspect is also an important one. It was also addressed by Svetlana when she said that it is of relevance which health concept is used for the development of healthy working life expectancy measures. Health is quite an ambiguous concept. There are many health indicators. You know, we have self-rated health, we have mental health. We could assess physical health, which may lead to totally different results. Chronic diseases, specific diseases or disease groups we could use in our analysis. We could look at sickness absence or at hospitalization. So in retirement research, the health concept applied and the health indicators used for analysis, they do influence the results, as the Dutch meta-analysis performed by Van Rijn et al. In the year 2014 indicates. Disability pension, for example, was predicted by all health indicators they had in the meta-analysis, but it was by far strongest predicted by perceived general health. Another exit path was early retirement, and this was only predicted by perceived general health. So it really matters which indicator am I using for my analysis. The third bullet, when researching the work retirement transition, health cannot be treated as a simple independent variable. There's so many different factors influencing the work retirement transition at the same time. So that health is one, it's an important one, but it's not by far not the only one, the only predictor of retirement timing. But even more so, the association between health and retirement is modified, or can be moderated or mediated by different factors. And studies have shown this could be workability, it can be finances, logically, and it can be education, and also the welfare regime has been identified as a moderator of this, as a mediator of this effect. Health effects on non-employment have been found to be consistently lower in the Scandinavian regimes. And finally, when investigating the roles of health affecting pathways out of work and timing of retirement, we should account for the diversity of retirement outcomes. And I think that Taina has already shown us the problem of measuring retirement. What is really retirement? And also, we can see that self-rated health, for example, is explaining a lot of disability retirement. In one study, 61%, of disability retirement and only 20%, 27% of this unemployment path into retirement, and only 9% of early retirement. And these findings were confirmed by further Dutch studies. So four more points. What we do need are more longitudinal population-based studies, which are specific to the investigation of the work-retirement transition. This means that they have to, in detail, assess work and health, and also this construct workability, of course, in this process. And then we concluded that national social policies aimed at extending the working life and the workforce, they shouldn't look at the timing of they should not only look at the timing of the exit, but they should also look at the way the people are going through this retirement process, which is longer than ever before, and especially those groups which may be trapped here, and these are especially those with high financial needs and also often migrants. More research is needed here. The impact of work on the roles of health and the work-retirement transition needs to be considered. Work could also be a means of enabling people of still keeping their health. As we know that overall work is better for health than it does damage. And finally, this was an interesting finding that the research we have identified was mainly done in a few countries, in the Netherlands, a lot in the Netherlands, but a lot in Scandinavia, also lots of qualitative work in the UK, also in Germany, and so some work in the UK, in the USA, and also in Canada. But it was in only a limited number of countries. And so we think that this predominance of research investigations in only a few countries in Europe and also Northern America is striking. But our research would certainly benefit from input from all countries. Thank you very much.
Well, thank you very much, Hans Martin. You introduced this complexity of the different roles of health in the retirement process, and even give a lot of recommendations for research. So there's still a lot of work to do for us as a researcher. So thank you very much. Where I need to say that you make it even more complex than it already is. Is anyone else who wants to ask a question to Hans Martin as to the role of health and also his avenues for further research, for future research?
Hi, Hans Martin. It's
Yes.
It's Mary Beth McLean again. I was wondering, in those 4 pathways, some of what was there, I think, and might be able to be teased out, and this is my area of research, is the area of involuntary retirement. And I'm just wondering if, and there's also this concept of involuntary work, which I think you've kind of, you've alluded to as the people who are trapped in poor health and work. So I'm wondering, of those pathways, and there was multiple ones within multiple reasons within those, which you could kind of tease out as involuntary pathways.
Yes, I think the concept of voluntariness is a bit debated, and because we don't really know what is voluntary. If someone is leaving early, like if I have severe health condition and I'm leaving, then the question is it and I want to leave and I cannot leave. Well, is it voluntary or is it not voluntary? But I do think that these pathways, indeed, that for some pathways have a higher degree of voluntariness than others, certainly.
Excellent, thank you.
Okay, are there any more questions to Hans Martin? Oh yeah, from Leon. Leon, do you want to ask the question yourself?
Yeah, thank you very much, Hans Martin. This is a wonderful presentation and very important work. Thank you very much. I'm just wondering if there is an estimate about the percentage of people in the 4 pathways in Europe, which are the most people, which are the smallest percentage of people.
Mm-hmm. I think one of the main problems is that the first pathway is so dominant. Yeah, it is so dominant, it is so strong, and it's so easy to understand that that we are likely not to acknowledge and see the other pathways. But of course we cannot say any figures, because it very much depends on the way how we how we conceptualize health or how we conceptualize retirement. But that's not the main point. To me, it's not the main point. I think the main point to us is that we have to be careful what concerns all these concepts and in our research, and that we limit the conclusions also to these concepts. It's not really important to know how many there are. Then when we are very concrete, like knowing about the financial, those that are trapped or that in involuntary work, as I just learned, there of course we should be able to somehow quantify this and to present it to policy from my point of view.
Thank you very much. Thanks.
Okay. Well, then I think, Hans-Martin, you already gave some nice issues for a broader discussion, including the role of us as researchers. And as said in the beginning, we would like to discuss some broader issues in the concepts of transition from work retirement research. So assuming that most of you are scientists, are researchers, I would like to, and I'm curious to hear what you think or we can do as researcher in the work retirement research. What is our contribution and what should be done to further understand the conceptualization and to measure the indicators of retirement? Who wants to comment or suggest something on that? Do we need to make some more clarifications or more clear? Is there a need for clear operationalization of retirement? Do we need to integrate health, for example, and the role of work in the framework that has been presented? Some suggestions, Hans-Martin?
Yeah, I know that in Norway, where retirement and the end of the working life are no longer, for many people, maybe Ingrid would know, maybe it's more than half of those of older people. It's not the same. Yeah, in Germany it is usually the same when the people retire, then they stop working. But it's not the same in Norway when they draw a pension and continue working. So this made it necessary to develop new indicators. And one idea behind the paper by Taina, and I think, and she also concluded that, was that we need more, let's say more indicators, or we need more items to assess retirement, to assess the diversity of retirement, so that we really know what we are measuring and what we are not measuring.
Mm-hmm. Taina, you want to comment on that? Do you agree?
Yes, that's a very good point, and one of the main conclusions that when going through retirement studies and trying to from them trying to see how has retirement been conceptualized and measured, it wasn't always very clear. So when writing scientific papers and when interpreting the findings, it's really important to always keep in mind, okay, what are we addressing now when we look at retirement? What elements are captured in this measure, for example, and how it compares to measures used in other studies?
Yeah, which are probably dependent on the national or international context. Which
Do we think that this framework will help, like
absolutely
bringing up what should and what is taken into account in this conceptualization, and how can a measure used in one country be comparable to that used in another?
Yeah. Someone wants to add on that?
Yeah, I would like just a few words. I think this type of framework is particularly important for communication with the policymakers and monitoring the changes across the time within the countries, but it also make a comparison across the countries, because with heterogeneity in the interpretation or conceptualization of these concepts, all concepts that we have been discussing today. So these estimates might be very much different. And in some cases, if they are not specified, that they would not be suitable for monitoring of the difference over the time, because this is very stable phenomena. And then if one part of this concept would be decreasing, another will increasing, so in the sum they would not be changing. So it's particularly really important for those who conduct the study that be very well describe what they mean by these concepts, and then make an interpretation or recommendations for policymakers based exactly on the concept, not in a general, just saying that that there are more people working beyond retirement, or so there should be also national background taken into consideration, that what is already Hans Martin mentioned, that different countries have different social policies, which is in a way forcing that this process would be ended up, and there would be rather few who would be employed beyond retirement, or otherwise around very much promotion is taken that people would be working beyond retirement. So all these probably it would not be possible to create universal concept that, and but it should be some kind of, maybe what it could be sort of some guideline for the reporting of these results of the studies which are addressing these questions, that what is important to be included in their reports, that the other would use their results.
Yeah, good point. Good point. And I see that Deborah Glass also has a question to variables or aspects that affect retirement, namely the relationship. Deborah Glass, do you want to?
I don't really need to add to that. I was just curious as to whether people have looked into that as a a cofactor, really.
Yeah.
Well, this isn't really my research field, but I know that there are some studies looking at like joint decisions, retirement decisions of couples.
Yeah, good.
May I comment that? I mean, this is just one of the many different determinants. I mean, it's not, we have relationships, the private family, for example, but also the friends and what they think. This plays a lot, according to our data, this plays a big role. But then, of course, there are many other factors that are influential in both directions. Yeah, so but let's better not start in addressing all these issues too. But of course, and this makes our research so nice. Let's put it that way, and challenging.
Yeah. Thank you, Hans Martin. You explain it, or you say it a bit more positive than I use the word as complex. You make it all more complex than it and challenging. but it really is, because all concepts cannot be defined in a simple way, or can be defined as a single event. So it's a process that is dependent on many variables, many aspects that influence the retirement process, including relationship, including finances, including health, etc. So that makes it nice and challenging for us as a researcher. I see that it's almost 12:30, and I promised to end at 12:15, so I did not succeed in that. But I think we had a very nice and interactive, informative webinar. And as said, it is recorded, and we will post it on the website, and hope to inform you about that. And if you have any more questions, just contact the speakers or me, and I will forward it to them. So I would like to thank you and wish you a nice evening and a nice day for those who are still who are in Central Europe, and hope to see you at the next webinar. Bye-bye. Thank you very much.
Thank you. Bye-bye.
Thank you. Bye.
Bye-bye. Thank you all.